Hello everyone, my name is Jonathan Andrade Bazan, PhD, and here we are going to talk about Ribavarin for chronic hepatitis E virus infection in transplant recipients and immunotherapy in renal cell carcinoma. Let's start with definition. And worry, and one of the main etiological agents occurred by hepatitis of enteral transmission in the world. Infection with hepatitis E virus is usually self-limited. However, case has been described of chronic infection and immunocompromised patient. Self-limited infection does not require treatment. Conversely, treat due to the risk of progression to cirrhosis or one of the extrahepatic manifestations reported.
Hey, thank you for watching Medicosis Perfectionalis. Hepatitis, the E mnemonic, also known as the EU mnemonic. Hepatitis E. Remember, EU. It causes jaundice in the Far East, Egypt, and by Egypt I mean Africa. And by the way, Egypt is my home country. India, Central America. Contaminated water. Contaminated is ew. Undercooked seafood. Sometimes some genotypes of Hep E are endemic in the swine. So undercooked pork can cause Hep E, hepatitis. So swine, pigs eat everything, including garbage and worms. So that's ew. No offense to pigs. Fecal oral route of transmission. Very sometimes it's common in pregnancy, and when it comes to pregnant women, it's fulminant. Fulminant means massive necrosis, lead to failure. Ew. And there is marked cholestasis in hepatitis E. Sometimes it's the most common cause of acute viral hepatitis. Wow. But, however, it also can be chronic, such as patient with HIV or patient with immunosuppression. Some textbooks, including Harrison's, which is my favorite book, I will link it in the description, it regards Hep E as an opportunity. Acute will have IgM antibodies in the blood, and chronic will have anti-HEV IgG. It's very similar to Hep A on electron microscopy. To remember, are both vowels. Okay, remember Hep D was dependent on whom? On Hep B. So you can draw D like this, and you have B, and A are vowels, so they go together, and these go together. Anyways, so that's it. Now you know everything you need to know about hepatitis E. But wait, there is more. And now, question of the day. Which is the most commonly associated with sexual exposure? Is it Hep A, Hep B, or Hep C? By the way, if you go to my Facebook page, there is an album there, contains all of the questions. This is the fourth question, so if you need to get them all, go to my Facebook page. Now, all you need to know about Hep E. Please go ahead and enjoy the rest of the day, and I'll see you later. Thank you very much.
I think the most interesting data and the one that people are very excited about is the Emotion 151 that we just heard from Dr. Bob Motzer. Bevacizumab with atezolizumab clear cell kidney cancer. So let me just give you a little background on how we treat landscape changes. In the past, but now we have VEGF inhibitors. So these are what we call the TKIs. Have the immunotherapy drugs, but mostly for second line right now. So with the advent of these trial, the landscape of treatment is really changing. So in this trial, though, what they saw in the progression-free survival, the overall survival is yet immature, but we are seeing that there is two co-primary endpoints. One is progression-free survival. As well population. And what they found was the PFS, for instance, for the combined of 7.2 months compared to only about 7 months for the sunitinib arm. So these are compelling data. And in terms of toxicity, actually there's not a whole lot that it's unexpected, if you will. So I think moving forward, this is a great candidate. Perhaps, we will be easier. I think it's rapidly evolving. And the trial I just mentioned, the Emotion trial, is but one of them. Last year at ESMO, we heard about the Checkmate 214 trial, which is a combination of nivolumab and versus, again, sunitinib, and that was also a positive trial. So we are starting to see now these combination IO drugs that are right now. IO therapy has with nivolumab. So I think we are starting to see these agents move up, and not just maybe single agents, but in combination.
Into application in medicine. Application in medicine. Let's talk about immunotherapy, renal cell carcinoma. Production with a 30% of metastasis patient of the and target led in remodeling, emphasizing the role. However, the long-term response are rare with a high rate of resistance. New strategies are emerging to improve the efficacy and emerging drugs. An order evaluation in the ongoing trial. With the different treatment options, there's an urgent need to identify biomarkers in order to predict the efficacy of drug and to better stratify patients. Let's see the third video.
So in moving forward, as Danny pointed out, extended progression-free survival, more than doubled, sometimes overall. It's an absolute for most kidney cancer patients. But having said that, where we have fallen short is that chronic therapy is required. Coming off therapy, disease progresses. Oral agents are still associated with significant, potentially life-changing side effects that change how people do. And we approaches. And at this point and throughout our literature, we're revisiting, Jan, the role of immune-based therapy. For those of us that have given immune-based therapy, you ask the question, what's the most likely therapy a person received for a period of time in the mission? For years or decades, it's IL-2. It does something about biology. So the question, Jan, is are we revisiting and are we doing it the right way? Did we learn the right lessons from the first experience? Are we applying it in the second experience? Are the endpoints, the biomarkers that we're looking for, other relations? It's a lot on your plate, but take a stab at it.
Thank you. Yes, immunotherapy is having a resurgence of interest, no question about it. Yesterday morning, we actually had a Society of Immunotherapy of Cancer symposium to talk about different approaches. And I will talk to your specific question, which is about the new understanding of taking the break. One point that was made, which is still underexplored and needs further evaluation, which is the combination of therapy to get not explored in humans, but very well documented in animals. So that's another direction that immunotherapy is going.
So let's just be clear so the audience understands. So by an abscopal effect, you mean that giving local radiation therapy to a targeted tumor could alter the antigenic expression in a way that might allow for an immunologic reaction at sites.
Correct.
And you think that whether it's in kidney cancer, obviously melanoma or other diseases, benefits of antigen exposure in the context of further immunotherapeutic approaches
are fascinating, which is that we have a system in the immune system where we stimulate and then we can control it with regulatory T cells or with other modulation of immune expression. And now we have discovered that both anti-CTLA-4 antibodies and now most recently anti-PD-1 and anti-PD-L1 antibodies can take the brake off the immune system and allow the immune system to identify and progress against antigens that are tumor specific. And, the clinical data are very compelling. We're seeing responses not only in kidney cancer and melanoma, but even in lung cancer and prostate cancer. So it's suggesting that tumors can be more immunogenic than previously believed. So the clinical trials, are we doing them in a different way? Duration. Whether we can combine these, we don't know. And whether we can combine them with each other or with other, no.
New hope for kidney cancer patients. And it comes in the form of an immunotherapy drug combined with a targeted agent.
I think this can many more options.
Dana-Farber Cancer Institute's Dr. Tony Schwery says this drug combination a co-corresponding author on a recent study with the drug combination than in patients who were only given the current standard targeted treatment.
Poor risk. We looked at different data set on this very large study, over 880 patients, and they all benefit from
in treating metastatic kidney cancer. He says more research is needed, but he's hoping to see FDA approval for this drug combination.
So we're pushing the envelope, and patients are living longer and able to receive more therapy. Is becoming more so chronic.
And cons. Pros and cons. Let's talk about again with hepatitis. Hepatitis represents a significant proportion of enteral transmitted liver disease and poses a major public health problem, mainly contamination and water supplies, especially the hepatitis E virus is responsible for cell-limited acute liver oral fecal infection. In industrialized countries, acute hepatitis A is sporadic, detected in a traveler from endemic area, but also is a sporadic case. HEV is a single strain RNA genome classified into four genotypes and a single serotype. Genotype 1 and 2 only infect humans and are predominant in the developing country, while 3 and 4 are predominant in industrialized other mammals, especially pig, and multiple evidence classifies. EGB is a solid Asian. Let's see video number 5.
So now let's meet some patients so we can put to work what we have learned about hepatitis E diagnostics. Our patient is Hannah. She feels sick and had to vomit at home. Her skin has a yellowish color. Her symptoms started 1 week ago. 4 weeks ago, she came back from Mexico when she visited family. Obviously, we think about hepatitis. Let's order lab tests. In Hannah's lab report, we can see that her liver enzyme function is significantly elevated. Furthermore, her hepatitis E tests are positive. Hepatitis E RNA is also detectable. So what's your diagnosis? Hannah has no history of immunosuppression. So let's take a look back at the graphic dealing with immunocompetent patients. Her ALT is very high, which signifies serious liver damage. Anti-HEV IgM and IgG are both positive, and we could detect RNA in Hannah's stool. Based on these results, we can conclude that Hannah is most likely in the early phase after infection. So Hannah is suffering from an acute hepatitis E infection. Let's see our next patient. Our second patient is Pete. He suffers from abdominal pain of recent onset. In the lab report, we can already see elevated liver enzymes. Pete received a lung transplant and is on immunosuppressive therapy. Furthermore, he tells us that he's a passionate hunter. Based on Pete's history, we include hepatitis E screening in our lab report. We can see that his liver enzyme function is significantly elevated. His anti-HEV antibodies are negative. However, the lab detected HEV RNA in Pete's stool. What does that mean? Since we know that Pete is taking immunosuppressive medication, we should consider this in interpreting his lab results. We know that immunocompromised patients can have problems producing antibodies to the virus. So in Pete's case, it is essential to measure RNA. His lab report shows elevated ALT levels as a sign of liver damage, but negative antibody tests. However, there is RNA detectable in his stool. Pete is suffering from an active, ongoing HEV infection. Based on the laboratory findings, we cannot determine when Pete was infected. It may have been recently or more than 6 months ago. However, it is not important to know that. What is important is that Pete gets appropriate treatment and follow-ups. Congratulations! Now you can handle hepatitis.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from. How Met Mastery can help you become a great clinician. Make sure to watch the About Met Mastery.
To usually apply in Ecuador. Therapy option for patients with NR expanded rapidly over the past decade with a target immunotherapy being the new cornerstone. Several emerging drugs are designed to enhance the antitumor immune.
Dana-Farber Cancer Institute researchers say an immunotherapy combination shows promise in treating a group of patients with.
And we saw overall is that in all 60 patients, about 33% of the patients had a response to therapy. So this response rate is
Looked at or renal cell carcinoma of variant histologies. These are a diverse group of kidney cancers that, when taken together, collectively account for about 20% of all kidney cancer cases. There are little data about combining immunotherapy with other drugs like VEGF therapy. Pathology is an important step in advancing care.
so this was investigator-initiated trial looking at the combination
And Dr. McGregor says in addition to the encouraging results, the study also found minimal.
hallmarks of this combination is it's incredibly well tolerated.
Dr. McGregor eventually offer more opportunities for patients with these rare kidney cancers.
And finally, the conclusion. The distinct entity in the specific molecular alteration. Among the CCRCC, the most frequently is particularly characterized by its ununited and immunogenic TNE, with a complex interaction within stromal and immune cell. A tumor cell intertumor heterogenic is presented in the TIE with a variable distribution and phenotype. I can simply favor receipt to treatment. We hope that in the future, new technologies such as single-cell technology contribute to unravel the numeric new treatment target.
I will present a study called RADVAX, so radiation vaccination, if you will. It's a small study that asks the question, do we see something about this mysterious definitive radiation, high dose stereotactic radiation to a tumor site can be potentially increased to potent immunotherapy. At the time when we designed study once and really applied 5 fractions of high dose, very precise radiation to 1 to 2 tumor sites. And the question is, do we potentially see an increased response rate as a signal that maybe that approach may improve the benefit from patients actually to be able 25 patients, we did see an increase, that this approach may actually increase and benefit the immune response in that context. It will be opposed to data from an Italian study. In response rate. So maybe this particular combination, maybe the presence of the CT, maybe the intensity of the radiation, maybe some of these factors are important to do it. It's a small study. To confirm the findings. One of the ways we're moving this forward with is that we will light up all the tumors in the patients and then see how inflamed are those. And then potentially pick out the ones that are the coldest, less inflamed tumors, aim the radiation to those particular immune response to otherwise very difficult to treat kidney cancer. Signal. It's by no means definitive, but I think that it's worth pursuing and seeing if this approach can enhance immunotherapy and potentially, I think a combination. Again, PD-1 monotherapy also was a negative trial, and so it will be very interesting to look at differences in the trial design and the outcome. But again, we have 25 patients, so it needs to be confirmed. But I would say for 25 patients, it's an encouraging activity profile, and we will have to demonstrate that this holds up.
Thank you for the